Good afternoon and happy Friday, Advanced team members. I want to take a few minutes and give you some updates around the agency. First, I want to start off by welcoming some of our new employees. We are glad that you've chosen to spend your time at Advanced and hope that you have a rewarding experience like all of us do. So welcome. I also want to congratulate a new member of the Advanced family. Little Nora has been born to our office manager, Ashley Stover. So we're very excited for Ashley and her family. So congratulations, Ashley. Before we get to any updates in the organization, I want to first thank all of you who have done tremendous efforts during these power outages to ensure that our patients have been receiving most excellent care. So I really appreciate all of you stepping up during this time of crisis. And that goes for all of our clinicians as well as all of our administrative staff. We've called 250 patients that we determined to be at high risk to make sure that they had emergency preparedness plans and safe locations to move to if they needed. So just a tremendous amount of effort went into making sure that all of our patients were cared for, even when some of our own employees had their power shut off. So thank you. I want to give you a quick update on our San Diego location. They have successfully implemented the WellSky application. So congratulations to Megan and your team down there. I think this is the start of us all working really closely together and starting to see the benefits of being part of a larger network and having access to more resources. So congratulations in San Diego, and I know that we will have some more exciting updates on San Diego coming out in the next couple of months, so stay tuned. Exciting news for our Sacramento and East Bay clinicians and administrative staff. We only have 15 working days left in 2 EMRs, so we are very excited to be making the full transition over to WellSky here at the end of the month. And that is when hospice will be coming on to WellSky as well. So lots of exciting things happening. I want to tell you about our new location in Walnut Creek. As many of you know, our lease was up at the office in Benicia, and so we have relocated our office into Walnut Creek to be more centrally located to John Muir and Kaiser, as well as a number of specialists that are down in that area. So we are excited for that move. We do think it will have a lot of new opportunities. We are excited that our new clinical administrator will be starting there in the next couple of weeks. So we are really excited for the opportunities that are going to be coming in our North Bay, or now our East Bay location. I want to thank Helen and Hazel and Mia and Deb and Angie for coordinating and finishing out some of the loose details of the move. So I appreciate your patience and your flexibility. We've got some exciting news this week that our hospice house is going to be getting its initial survey, so we can start opening and serving patients there. This is obviously going to be very exciting news for our hospice program, as well as other agencies will be able to place their hospice patients in our hospice house. So this is going to be a real benefit to the community that I'm really proud to say that we're going to be offering. Over the next couple of weeks, many of you will be receiving specific training related to PDGM, which stands for Patient-Driven Groupings Model, which is a change in the Medicare benefit for home health care. And we are going to be doing extensive training over the next couple of weeks to prepare for this change, which goes into effect on January 1st. The good news is that we have already analyzed the impact of PDGM, and agencies like Advanced and our agencies in our network are actually going to do quite well in PDGM. Of course, there are going to be some things that we need to change fundamentally to make sure that we are successful. It's that time of year again. I encourage all of you to get your flu shots. They are available in your office, so please do that. And I want to thank the many clinicians out there who are advocating for our safety of our patients and our staff and encouraging people to get the flu shots, like one of our LVNs, Olivia. So thank you, Olivia. Going to be a formal announcement coming out fairly shortly, but I am glad to say that the board for Excellent, our parent company, has selected a new CEO. I had the opportunity to speak with her for the first time yesterday. I was very impressed. I think that she is going to bring a lot of her skills as a nurse executive and as a home health and hospice executive to our agency and really help us get to that next step. So please be on the lookout for a formal announcement that will be coming out shortly. I've heard some amazing stories about some of our staff this week who have gone above and beyond to make sure that our patients are cared for, such as one of our occupational therapists, Bo, who is once a week traveling a significant distance outside of his normal service area to make sure that patients in another area are being cared for while we are trying to recruit for a position in that area. So thank you, Bo, I appreciate it. And also to our many hospice nurses, especially Sandy and Joy, Christine, Sandy Tucker, and Tanya and Amber, who are really adapting and providing very high quality care while we are experiencing a significant amount of referrals and interest in our programs, which is a good problem to have. Of course, we are actively recruiting, so if you know people who would be interested in joining our advanced family, then please have them go to our website. There can be sign-on bonuses for successful recruits, as well as referral bonuses if you refer somebody to work here. So please consider that. One thing that I've noticed around the office is that there are a number of new faces, and I'm sure that many of you are experiencing that as well. I want you to know that while it is sad when our coworkers and our work family members leave, we also have to be thankful for the future opportunities that they will be afforded and in the progression and growth in their own personal and family development. So while it's difficult to have a lot of new people and change our work friends and family, consider it new opportunities to learn about people and their cultures and backgrounds. Unfortunately, when you work in healthcare, there is going to be a tremendous amount of opportunities out there. And we want to encourage people to grow in their profession. And so unfortunately that means that we have to sometimes say goodbye to good employees. And that is unfortunate, and we do hope that one day they come back to our organization. And we've had many experiences where that has happened. So while it is difficult, I really encourage you all to try and see the positive in some of these departures and look at it as a new opportunity to meet new people, experience new things, and to learn and grow yourself. With some of the recent departures, I've heard people comment that the culture has changed in the organization. And I think that is a valid comment to make. The foundation of our work is caring for patients, and that will never be sacrificed. But the things that we do administratively and operationally do not affect the patients except in positive ways, which we are seeing with our increase in patient satisfaction, our increase in star rating, our decrease in hospital readmissions, and we have a number of exciting things coming out that are going to continue to improve patient care, such as our sepsis program, some artificial intelligence that's going to help us identify patients that might need care in the future or more care immediately, as well as new tools that will help us improve patient communication and monitoring. So the values and the organization is changing in advanced and in excellent, and we think that it's changing for the best, and sometimes people disagree with that assessment. And so people make decisions that are best for them and their family at that time. And we have to do everything we can to be supportive of those decisions and hope that they eventually make their way back to advanced, and wish them all the best on their journey. As we close off today, I want to give a warm shout out to Stephanie Fletcher, who I heard the most heartwarming story from. She helped a community member in need and went out of her way to do it. I hope you all have a wonderful weekend, and I will see you on Monday.